Springtime's and harvest, sun, moon, and stars in their courses above. Join with all nature in manifold witness to thy great faithfulness, mercy, and grace. Great is thy faithfulness. Great is thy faithfulness. Morning by morning, new mercies I see, and all I have needed, thine hands have provided. Great is thy faithfulness, Lord, unto me. Summer and winter, springtimes and harvest, sun, moon, and stars in their courses above. Join with all nature in manifold witness to thy great faithfulness, mercy, and love. Oh, great is thy faithfulness. Great is thy faithfulness. Morning by morning, new mercies I see, and all I have needed, thine hands have provided. Great is thy faithfulness. Great is thy faithfulness. Great is thy faithfulness, Lord, unto me. Thank you, Jesus.
Amen. Thank you so much. That was Sister Ingrid Bent. We want to thank you so much for that wonderful song. And now we'll turn over to Dr. Pansy Samuel.
Good evening, everyone.
Good evening, Sister P.
Good
Thank
evening.
you, Sister Henry. Good evening, brothers, and if there's any brothers on, sisters, good evening. Sister Henry, I just want to say thank you for the opportunity. I was trying to shy away from it because I'm not a psychiatrist, but I have some information I have to share, and I know the Lord wants us to hear it as a people, as sisters in Christ, and that we can share with others. Can I share my screen? Whoever is the host, can I share my screen, please, ma'am?
Go ahead.
Hold on one sec. You are sharing. One second.
Are you looking for the slideshow?
Yeah.
If you go to the bottom where next to the image, you'll see where it says notes, comments, keep sliding over at the bottom. And keep going to the screen, the one that looks like a screen at the bottom.
I'm not seeing what's
So notes, comments, keep going over till you see the one that looks like a screen. Nope, your OneDrive just popped up. Close that out. right, it's, let me see, can I drive? No.
Hold on 1 second. Let me
Yep.
stop sharing for a while.
All right.
Then let me do my slideshow first. Then let me do my slideshow. Play from the start and then and see if I can share from there. No, share is not available. Okay, it's not okay. Share. Let me go back.
Now you can hit play from the start.
It's not
Under home, can you see play from start?
No. Hang
It's
on.
not, it's not allowing you to play.
You've probably seen it, but I'm not seeing it. Pause, share, hold on, slide control.
Not share, I can see your screen. So if you go to the under home and hit play from start, right there, keep going. Nope. Go to slideshow and hit play from start.
All right, I got it.
There you go.
All right. Sorry about this hiccup, sisters. Thank you for the opportunity, guys, to share a little of what I know about mental illness. My name is Pansy. Now I come to you with some nursing experience in mental illness. And also I had my daughter that had a nervous breakdown, which is a psychological illness. How many years ago now? 2018, 2019, a couple of years ago on a mission trip. And I also have family members. I have two brothers who are mentally ill. Their onset was around age 21. We have a weak gene, and on top of that, they ended up smoking substances that kind of throw them off. And I have a maternal aunt and her son, which is my cousin, who are also mentally ill. So I've experienced the stigma, I've experienced the cultural misconceptions about mental illness. And so I'm in a position to share a little bit of what I experienced and from the knowledge I gained from my training. So our objectives tonight is to define what mental illness is, identify the types, the causes, what are the risk factors, signs and symptoms. How do we know somebody may have had some mental illness, and diagnosis and treatment. And then we're going to incorporate a little bit of what our faith, what we believe, and how does it relate to mental illness. Just a disclaimer, this presentation is for our understanding, to increase our knowledge and awareness about mental illness. It does not replace any of our medical or psychiatric consultation or treatment plan. If anyone listening have any signs of symptoms of mental illness or they have a concern, I would advise you to seek medical attention, psychiatric consultation, professional help. That's just a disclaimer I need to say. So, mental illness, just an overview. It is common. 1 in every 5 adults has a mental illness. There is cultural misconceptions. There is public stigma against mental illness. And the public stigma is real. I was living in Grenada at the time when my brother had an acute episode of mental illness. And because I was working in healthcare already, I had him seen by a private psychiatrist because of the stigma. I didn't want anybody to know I was taking my brother for psychiatric help. So there is a stigma. It's still real today. And from being more aware of it, just as how we are sick with other ailments, with our heart, our kidneys, our lungs, we're hoping eventually that that same conversation can exist when discussing issues related to mental illness. Mental illness can begin at any age, from childhood through later adult years, but most cases begin earlier in life. The effects of mental illness can be temporary. Some people have an acute episode, and some end up having long-lasting implications. You can have more than one mental disorder at the same time. For example, you can have depression, you can have anxiety and depression together. You can have depression and then dealing with a substance abuse disorder. In most cases, symptoms can be managed with a combination of medications and psychotherapy. Mental illness, what it is, it's mental, you also would hear that name, mental health disorders. They're all under this umbrella. It refers to a wide range of mental health conditions that affect our mood, our thinking, and our behavior. Mental health concern becomes a mental illness when ongoing signs and symptoms. There are times when we have a brief episode of something, some stressor in our lives, and it's resolved and we're okay, but then there are some symptoms that don't go away. They linger on and become issues. So the frequency and stress can affect our ability to function. And so people who used to be up and about and, you know, participating in activities of daily living, going to school, doing their work, their relationships are going okay. And then all of a sudden they are in bed, in the dark, they don't get out of the bed, they're not able to care for themselves, poor personal hygiene, their grades, they're not interested in schoolwork, they're not interested in the things that they were interested in before. Then we're starting to think something is going on with the brain. There are also some conditions. Sometimes you have a medical condition that is lingering. You end up getting frustrated, stressed, worried, and then it can lead to dynamics that goes on with the brain that brings on some mental illness. What causes mental illness? For us, my family, we do have a gene, so inherited traits. Mental illness is common in people whose blood relatives also have a mental illness, as I told you before. So one of the things I did with my kids, I let them know very early. And as I would always say, our family can't afford to stress because we do have a weak gene and anything can tip us over. And I think probably that's what my brothers, it tipped them over, and that's what happened to my daughter as well. Certain genes may increase your risk of developing mental illness, and your life situation may trigger it. So we have a gene, we have a stressor, a big stressor that causes us to be worried, be stressed out, and then that can tip us over. Environmental exposure before birth. We're talking about babies in the womb, certain drugs and substances that cross the placenta, the baby ingests all of that while in utero. And so when that child is born, he is high risk for developing mental illness. Brain chemistry. There's a lot of talk about how those neurotransmitters, those substances in our brain, how it functions. They are naturally occurring brain chemicals that carry out signals to other parts of the body. So when we call this a chemical imbalance of the brain, then that can trigger the beginning of some mental problem. The risk factors, we mentioned that a history of mental illness, stressful life situations, like financial problems, the death of a loved one, a divorce that can cause really, really serious stressful conditions. An ongoing medical problem, it may be a chronic disease, it may be something autoimmune, maybe just simple diabetes, it may be pain control issues where you're always in pain, you're miserable every day, and you can just trigger some imbalances in the brain that throws you off. Traumatic brain injury, you may have a motor vehicular accident or some violent blow to the head that shake you up and cause you to have some mental illness. Traumatic experiences like the veterans in combat, and you know, these people have what a lot of them develop what we call PTSD. Use of alcohol and drugs. So these substances alter the functioning of the substances in the brain, and that can lead someone to develop mental illness. A childhood history of abuse and neglect that can trigger. Anytime you have somebody with no friends, few friends, and they cannot maintain a relationship, a lot of times something is going on. Not always. We cannot just diagnose those things. A thorough history, family history, and that will kind of give us a clue. But one person may have, many symptoms. Somebody with 1 or 2 symptoms may not be the case. But that is why a specialized psychiatrist, may be able to help with the diagnosis. Any history of any previous mental illness, like 5 years ago, you had a depressive episode, and then you have a stressor in your life, a divorce, death of a loved one, that might trigger that same events, and you may end up going back into a state of depression again. Types of mental illness. The list is very long. We'll just list the common ones. Depression, feeling of sadness, deep sad, not just sad, but deep sadness that you are locked in, you're not taking care of yourself. You are in like somebody explained it to me as a deep, narrow place, a hole where you cannot see your way out. Anxiety, these are adjustment disorder kind of people, trouble coping. They're always anxious. They're always edgy, panicky. Post-traumatic stress disorder, we mentioned people who go through trauma and they end up having panic attacks even after the trauma, years after, when memory brings back all of those experiences they had, they go through that period. Veterans, or a lot of them are victims of that. Schizophrenia, there's a lot of schizophrenic episodes. There's a spectrum of those. And psychotic disorder causes detachment from reality. Sometimes you hear somebody speaking words of delusion. Somebody will come to tell you, oh, I'm the president of the United States, or I'm the queen, delusional kind of grandiose delusion, hallucination, hearing voices. Hallucination is a term that also comes up out of people who are withdrawing from alcohol or other drugs. They hallucinate, they see things, they hear things. Disorganized thinking and speech, they're not making sense, they're talking very fast. Then you have the bipolar, bi mean two. These group of people get really depressed on one episode, and the next episode they're manic, they're crazy, they're high energy, excessive activity, and they don't sleep kind of way. Then we have the neurocognitive disorder that takes in our dementia, Alzheimer's. And these are really diseases of the aging brain. However, we've seen the younger group, 50s coming down with dementia, Alzheimer's. I had a friend that I worked with in critical care, and she started making errors. And that's when they pick up, she had early dementia, and she had to be forced into retirement. So those are really disease of the aging brain, but you can have younger people coming down based on what's going on. Then you have the substance abuse and the addictive disorders. They also fall under mental illness, because these group of people, they drink and drink and drink, and they don't know when to stop. So they are addictive to those substances. And many times they try numbing themselves of whatever is going on in their life so they don't have to deal with it. Then you have the eating disorder, the anorexia, the binge eating. I work with Pathfinders. We had one child, a mom, they just went through a divorce, and the mom alerted me, the child does not eat. And so I have to look out for this kid. They go through those psychological stressors that puts them into those kind of phase of not wanting to eat. Gender. This is a big thing of the day now. This refers to the stress that accompanies a person's stated desire to be another gender. That's So that's a whole psychological something that's going on with the brain that causes people to not wanting to be the gender, but want to be something else. It is not normal for somebody to come up and say, I'm not a girl, I'm a boy, or I'm in a girl in a boy's skin, some things like that. Disruptive, impulsive control, and conduct disorders. So you have the impulsive people, they don't think, they just do. And these behaviors can be very dangerous. You could be talking to somebody and they just become impulses and hurt you or hurt somebody else or hurt somebody. And then you have the paraphiliacs, and these are the people that has all these sexual interests that causes personal distress or impairment to someone or themselves. And then you hear of those being attracted to dead people, to animals. These are a set of behaviors that's not normal. It's because of something that's going on with the brain that people resort to those unhealthy practices. The signs and symptoms of, there's a lot of them. Feeling of sadness is probably deep sadness, feeling down. We women go through those phases during our menstrual cycle, so it's not that. It's a more extensive, deeper sadness that people that experience depression, mental illness, that they go through. Confused thinking or reduced ability to concentrate. You cannot concentrate. You used to be concentrating at work, at school, and for some reason you cannot. Excessive fears and worries, extreme feelings of guilt, extreme mood changes, highs and low. That sounds more like the bipolar. They're high today and next week they're low. Withdrawal from friends and activities. So if somebody who enjoys church activities, social events, and all of a sudden they stop going, they're locked up, they're not coming out, they're not caring for themselves. These are clues. Significant tiredness, low energy, a problem sleeping. You can be sleeping too much, or you can experience inability to sleep, insomnia. So it goes either way based on the person. Detachment from reality, we talked about that. They're delusional, paranoid. They started hearing voices and seeing things. Depressed mood, loss of pleasure, interest on the things they used to enjoy. Now they're not enjoying it. Sleep, we talk about. Fatigue, loss of energy, feelings of worthlessness or guilt, and suicidal ideation. Now, suicide, it's a big thing. I'll get to that in the next slide. Inability to cope with daily problems or stress. So normally on our day-to-day basis, we do have things coming up that we handle. If you find yourself not being able to cope, you're overwhelmed, you're stressed, and you would feel something is going on with yourself, that's a clue. It may not be, but pay attention. Trouble understanding and relating to situations and people. Some of these people, the schizophrenic, the bipolar, it's difficult to understand and relate. They talk fast. Sometimes they're not making sense. When their mind are made up of things, even though it's not safe, they are so adamant in pursuing some of those. Problems with alcohol or drugs. A lot of people resort to those substances when they're highly stressed as a way of numbing them from the reality of the situation, but that's not a good way to handle stress. Major changes in eating habits. Some people, when they're depressed, they eat too much and gain weight. Others, they don't eat at all and they lose weight, or they're anorexic, or they eat and they vomit. Eating disorders that we mentioned. Sex drive changes, their libido will be decreased. They're not interested in sex, or it could be the other way around too. Excessive anger for simple things that doesn't warrant anger, hostility, and violence may lead to that. And of course, we said changes in appetite. Some of the things I repeated, didn't realize. Now, first, before we go to treatment, let's think of ways we can prevent. Sometimes we get warning symptoms and we're telling ourselves, no, that's not it. But we need to pay attention. If you start feeling down for a prolonged period of time, I'm not talking about 2 days of the menstrual cycle, you're down. I'm talking about you're down for a couple of days, deep sadness, You don't want to get out of your room. You don't want to interact with anybody. Something is up. So we're going to have to pay attention. Get routine medical care. What routine medical care does is your primary care doctor may be able to pick up on certain signs, because some mental illness first present as physical signs, and then they do their workup and they find something is wrong. Get help when we need it. Because of the stigma, no one wants to go to see a psychiatrist or a psychotherapist. So no one wants to go to the doctor and say, I feel depressed, I have anxiety, because of course, all of these goes down to your record and you don't want anybody to know that. But the reality is the longer we stay, the harder it is to treat. Mental health condition can, be harder if we wait and then the symptoms get bad. Long-term maintenance and treatment also may help to prevent relapse of the symptoms. Some people have just one-time episode of a mental illness, they seek help early, they're okay, and for the rest of their life, they continue with the treatment, whether it's psychotherapy, medication, or whether really taking care of themselves, and they're able to live normal lives after that. Our next one says we have to take care of ourselves to prevent those things. So for me, with this big family history, I have to make sure I get enough sleep. Never mind, I did nights for many years. I'm not going back to nights, period. Get enough sleep. We got to eat healthy. The bottom line is we have to go back to the laws of health. Exercise regular. We will come to that, because what exercise does, it releases some of those endorphins and it helps us stabilize of the chemicals in our brain, and that helps prevent all those mental illness. When we talk about caring for ourselves, we also mean physically, spiritually, mentally, and socially. So all the dimensions of the human body need to be cared for to prevent the brain from going crazy. A diagnosis is made by a professional. What we do in primary care, we will be able to get a history, get your family history, and of course, that's in my record. To be honest, guys, I don't like to see that on my record, family history of mental illness. But guess what? It is the reality. And because my provider knows that, then if anything comes up, they will know how to manage me because of my family history. So your doctor will try to rule out any physical problem that can be causing your symptoms. But I advise us as ladies, make sure you go for your annual physical. I go. I don't have no chronic disease, but I go. I had a brain event a couple of years ago. I still see a neurologist every once in a while. Not that I have additional symptoms, but so it is really important to go. What that provider needs to do, rule out any possible causes, any physical causes of that mental problem. For example, there are people who have liver disease and they end up having this metabolic encephalopathy where they're confused, and it may be read as a mental illness when they're having a chemical problem with the liver or the kidneys. So what the primary care physician will do, run tests. Is your thyroid functioning okay? Do you have any substance in your body that's too high, any levels that's out of range? So you rule those things first, do the lab work, and then you have a psychological evaluation if you have symptoms relating to mental illness. And what that professional will do, they will screen you, ask you a lot of questions, and give you questionnaires to give you a proper diagnosis. There are a wide range of mental illness. So if you're being interviewed, if you have to give your history, I would advise you tell them everything that happens to you so that will guide them into treating you. Now, the American Psychiatric Association published the Diagnostic and Statistical Manual of Mental Disorders, which guide all the psychiatrists in this country. They use that to make a diagnosis of a mental condition. So these are the specialists, they deal with that, and they will be able to accurately, sometimes diagnosis based on my experience. Sometimes some physicians try to go by the book, but based on what a patient is presenting, they may present differently, but they do have a guide that they need to follow. The Center of Disease Control also have some guidelines that that can guide those providers into coming up, determining which kind of mental illness we have. I mentioned earlier on about suicidal ideation, suicidal thoughts. This is a big, big issue. We have a lot of young people resorting to hurting themselves. If you know of anyone, or if anybody have signs of mental illness and they have suicidal thoughts, they want to hurt themselves, they have a plan, this is a medical emergency and 911 has to be called. There is also a suicide hotline. You can text 988. You can reach the 988 suicidal and crisis lifeline. They are available 24/7. Suicidal thoughts are common for people with mental illness. If you know of anyone, if you yourself have those thoughts that needs immediate attention, please do so. Back to the provider. When you go to see your doctor, when I was doing clinicals, we screen all adults. We give them a form. I don't know if you guys came across GOD-7, General Anxiety Disorder 7. So we screen, we give you that questionnaire, and we have a scoring system. So it will tell us if you're having any signs of anxiety. And then there is the PHQ-9. PHQ-7 is for kids. PHQ-9, which means Patient Health Questionnaire. These will screen you for depression. So every year I go to my provider, they hand me these two forms. I check, and they assess whether I have any level of depression or anxiety. That's the first step. If anything scored high on any one of them, referrals are made immediately. If at your annual visit, your score on depression is high to the point where you're having or experiencing suicidal ideation, you would not be sent home. You will be, there is a process that goes on where you have to go to a medical facility, a psychiatric institution immediately. And so these are the protocols we follow as healthcare providers to prevent people from going home and hurt themselves and hurt others. So when do we seek help? Have an open, honest discussion about our health concern. If your loved ones, you notice something, have a conversation. Offer encouragement and support. Assist with finding a qualified health professional. You can take that person to the hospital. Call emergency for help. What I wish I can do as a mom is to, you see some, my children have this, that, pick them up, take them there. The thing about it is when we're dealing with adults, even though sometimes they're not talking straight, we don't have the ability to pick up an adult and drop them off at a psychiatric unit. You have to talk people into making decisions that will be healthy for them. And if it's our loved one or somebody we're close to, engage them in a conversation, let them know your concerns and offer them the encouragement and the support. And even if you have to find a healthcare provider for them and call up and help them make that appointment, do so. Suicidal risk, well, that's where I had that. The GOD-7 and the PHQ. So all depressed patients should be assessed for suicidal thoughts, suicidal ideation. Ask about the specific nature. Now, if that person have an intent, a plan, they have a gun, you know that person is in danger, that person you should be calling 911 for that person. Assess the patient for risk factors of suicide. There are people, as we mentioned, they do have family history, or they do have a previous episode of mental illness. They are high risk. And then for all who have this, you're dealing with a family member who are depressed or suicidal, there must be a safety plan for further evaluation and treatment. That person should not be left alone. Nobody with any suicidal thought should not be left alone. They should be screened. If that person is institutionalized, they have all the precautions over there to make sure that person is safe. But if they're with you, we have to make sure that this person is safe as well. But anybody that come to you and say they want to kill themselves, do not take it lightly. When we moved here, there was a young man that went to the academy as our kids, and they had a beach day. They went to the beach, and the young man said, "What if I just throw myself and kill myself?" And they laughed it out as a joke. And 2 years later, he shot himself. So people may sound as though they're it's a joke, but take them seriously. Your treatment team, if there is an issue, you would have a group of people that will be managing your care. And I know sometimes it gets a little challenging. The mental illness patient population are underserved. There isn't a lot of providers that go into the field. Now they're offering scholarship for people to enter that field so that you can have more providers. The placements also, if they need to be institutionalized, there are not many, especially our area I can speak of. Sometimes we hold a patient in the emergency room until a bed is available in the psychiatric unit. And I know there are a lot of challenges trying to navigate all the specialists involved in the care, but here are the people that you call, or you have an issue with your medication. The pharmacist can tell you how the medication works, what are the side effects. Your primary care doctor is the one you will be seeing yearly. Your psychiatrist you will be seeing from time to time when they need to make changes, or you need to see the psychotherapist to talk through your issues. You need to see the social worker when there is family dynamics. For example, people get stressed and depressed and anxious over family dynamics, and the social worker is there to kind of help you navigate. There are kids from divorce. There are kids that spend 1 week with mom, 1 week with dad. It's hard for these kids. These kids end up getting mentally ill. They get violent. They get delinquent. They end up showing signs of mental illness. The social worker is able to sit down with families and see if they can work out a better plan for the kids to prevent them from going into those episodes. Even adults, when they go through the stress too. Family support is key. I remember when my child came back from Cuba 2018. She left 2018 December. She came back January. When I saw the child, I started to bawl because I just saw it. Apparently, the signs were there. They didn't know what it was. That is why we have to be knowledgeable. If you see somebody and the kid was all excited, she's going on a mission trip, they were involved in VBS and all that sort of things because it was she looked forward to, and come to find out, the kids slowed down after week 1, started exhibiting signs that the people didn't know what it was, because I had to write, and I had to take it up so that that doesn't repeat itself. And so there was a lot of factors that contributed to her breakdown. It was a rigorous trip. The Cuba system was different. There was a lot of her period came. There was a lot of factors that was contributing to that. And so family support was key for her. She never ended up on medication. What we did was we had to be there for her. And so she went for a series of psychotherapy, talk therapy. And she's much better, thank God. But family support is key. The family has to support people who are, and I know because of the stigma, you don't want to associate, you don't want to be the one to say, oh, my child or my loved one is mentally ill. But if that's what it is, we got to rally around those people and provide the support. Medications, and I know some of these medications, not some, all of them have side effects. Although the psychiatric medication don't cure the mental illness, they can often significantly improve symptoms. Psychiatric medication can also help make other treatments, such as the psychotherapy, more effective. And so, but the decision is yours. If there is an issue, you can try medications, you can try the psychotherapy. If you have no results from the psychotherapy, medication can be a best option. And then the best medication for you will depend on your particular situation and how your body responds, because every one of us have different body chemistry. What will work for me may not work for you. So I just listed here a group of medications, antidepressant, mainly for depression. You would find also the bipolars are sometimes on 2 sets of medication. Anti-anxiety, there's a lot of anxiety going on in our area, and I only realized that when I did, even among our young folks, I did a pediatric rotation, and 13 to 15-year-olds, they are on some anti-anxiety med. They're anxious. One of the articles I was reading the other day, a lot of what's going on with our young people relates to the social media one and the use of their devices. And it seems like parents give cell phones and tablets at a very young age now. I work with Pathfinders and it's a problem. And we don't realize the amount of damage. And so a lot of the kids, their social development is stagnant because they're always on those devices. And so we have to be careful. I just needed to throw that in there. You have mood stabilizers and you have antipsychotic medications. Psychotherapy is really talk therapy. You see a specialist, you talk about your condition, you learn about your condition, how your moods work, how all those neurotransmitters in the brain works, how your feelings, your thoughts, your behavior, all of these are connected. And with that kind of insight and knowledge you gain, you can learn coping and stress management skills, because a lot of times mental illness stems from stress management. And if we can manage our stress and coping skills, then we'll be a little better. Others that are due from genetics, then that can help, but they probably will have to be on something to help them. Other management. Sometimes we do brain stimulation treatments. That's when they shock the brain a little bit to get it back into rhythm. And also, if we go back to the 7 laws of health, diet and exercise. Exercise is a big one. Exercise improves mental health by reducing anxiety, depression. It reduces negative moods, improve your self-esteem and cognitive function. It releases the good feeling, the feeling good hormone neurotransmitter, which is the endorphins. That is why we feel good after we exercise. So I started exercising at the end of 2020, COVID. I was 190 pounds. So I started exercising mainly for my weight. But man, let me tell you, it has become my medicine. And I went out there this morning and I did, elliptical, my weights. And I feel so good. When I come from there, I feel I can conquer the world. So that's the kind of benefits exercise has on the brain. And I encourage all of my sisters, brothers and sisters, to just start little by little and make it a routine. Adequate sleep is a big one. If we're not sleeping, we're not eating, we're not exercising, we don't get sunshine, we lack vitamin D, then all of those put us at risk for developing all of those illness, including mental illness. So in addition to whatever your psychiatrist may have you on, maybe Prozac or whatever it is, we still also have to be proper diet, eat the right foods, fruits, vegetables, water. It's amazing when we screen young people or older people in the community and ask them, do you eat fruits, vegetables? Then there is a silence. Fruits and vegetables should be part of our daily diet, daily meal. Water, we're supposed to be drinking half of our weight in ounces. So I'm 170 pounds, I should be drinking, 85 ounces a day. Sunshine, in my area, I don't get a whole lot of sun because of where we live, so I take vitamin D every day. I also take a calcium and vitamin D because I'm aging. And so any kind of medical treatment for underlying conditions. So the goal is we do what we can on our end and then leave God to do the rest. For the people who have drug problem, they need to go to rehab and to rehabilitate them from whatever substance. So alcohol have the Alcohol Anonymous, and all the other drugs, they detox them and they get them sober. And then they're being followed up. They do their urine screen every year or every couple of months or so, whatever the regimen is, to make sure that they are clean. So all of this is in addition to whatever treatment plan, whether psychotherapy or whether some form of medication. We need to be following those so that we can optimize our health. Let's talk about our faith. So earlier on, we mentioned there is a stigma, and also there is a stigma among us Christians about mental illness. In fact, when my daughter became sick, the psychotherapist had asked, do you have, if I have any idea if there is any evil influence over my daughter? I didn't know, I wasn't in Cuba at the time, but these are the possibilities. And sometimes we tend to downplay mental illness into maybe it's, demon possessed, or maybe it's some evil influence and we're going to pray it up. That can work, but let me tell you, we live in a sinful world. Illness occurs to anybody, the just, the unjust, just like how rain falls on the unjust, rain falls on the unjust. When I was diagnosed with a brain tumor, there was no explanation for that. I didn't have a family history of those tumors. I don't drink. I don't do any risky behaviors. I did all my research, and the only thing that they came up with is, during pregnancy, the progesterone caused growths of some, tumors. And that's the only thing. So a lot of times there isn't an explanation for that ailment, including mental illness. What I do know is God gives us wisdom. We are required to seek the Lord's guidance and seek professional help when faced with mental health challenges. So remember that story in John 9, 1-6? As he went along, he saw a man blind from birth. His disciples asked him, Rabbi, who sinned, this man or his parents? What was Jesus' response? Neither this man nor his parents sinned, but this happened so that the works of God might be displayed in him. And so people back then was thinking he was sick because of some sin, but that wasn't the case. Let's look at the woman with the issue of blood. And the goal here is, look at all the different. One thought it was sin. The woman in the issue of blood, she went to many physicians. They couldn't help her. She needed more than physical, obviously. She needed spiritual and physical. Luke 8:43 and 48. Now there was a woman who had been suffering from hemorrhages for 12 years. And though she had spent all that she had on physician, no one could cure her. She came up behind Jesus and touched the hem of his garment, and immediately her bleeding stopped. And so none of the physicians, she needed Jesus, who was a great physician, to heal her. What happened with that demon-possessed man in Mark 5, 1-5? He was possessed, he was acting. Actually, I was searching the scripture to see if anyone with a mental illness and how it was handled. But how Jesus handled cases is so much different to us, one. And if we belong to a movement and things have changed, God knowledge increased, then we have to use our wisdom, God's given wisdom and divine guidelines to seek the help we need. So that demon-possessed man, he was possessed with many lesions. Now there was that's Mark 5, 1-5. When Jesus got out of the boat, a man with an impure spirit came from the tombs to meet him. This man lived in the tombs, and no one could bind him anymore, not even with a chain, for he had often been chained hand and foot, but he tore the chains apart and broke the irons of his feet. That reminds me of the bipolars. They get really strong and they can, lift up a house. So that's signs of mental illness. He was possessed by demons. No one was strong enough to subdue him. Night and day among the tombs and in the hills, he would cry out. When he saw Jesus from a distance, He ran and fell on his knees in front of him. He shouted at the top of his voice, "What do you want me? What do you want with me, Jesus, Son of the Most High God? In God's name, don't torture me." For Jesus has said to him, "Come out of this man, you impure spirit." Then Jesus asked him, "What is your name?" And then he replied, "My name is Legion." So there is this, and there is many occasions in the Bible where people were sick and they were seeking attention. And that's the thing about our faith. Yes, you seek the necessary attention. If we have diabetes, we go to the doctor, we get help. We have high blood pressure. When it's mental illness, we pray and we say we don't want medication. I think there is a disconnect here. But each one has to be led by the Spirit, the knowledge and the wisdom you have about the condition, how it can affect you, the long-term effects, and then make a decision. We also have to be aware of evil influence, as with that demon-possessed man. There are certain places, let me share my experience. There are certain places you go and you can just feel you are in the wrong place. Sometimes you cannot lay your finger on what it is. It just feels evil, like you are not in the place. Then you know you have to make a decision. You need to get out at whatever place you're in that makes you feel as though you are being overcome by some evil influence. And these things are real. Being possessed, being overcome by evil influence. But here is the thing. If you have signs and symptoms of mental illness, we are all believers. God can heal. There is no doubt about it. I believe in my God. I have been praying for healing since 2008 when I was diagnosed with a brain tumor. God didn't heal. I still have facial paralysis. Got to deal with it. The thing about it too, we don't know. I don't know for sure how God works. Some days I try to understand God and I try to say some days, Lord, I really don't understand you, but all I can do is trust you. Maybe it's not his will to heal me. Maybe he is pointing me in another direction. So pay attention to the Lord's leading, but I would encourage you, if that's the mental illness is an issue, then we need psychiatric help. We need professional help. Finally, beloved, I wish above all things that thou prosper and be in health, even as thy soul prospereth. 3 John 2. Spiritually, physically, mentally, emotionally, and socially. In the grand scheme of things, if I have to worship God in spirit and truth, my mind has to be sound. My physical health needs to be intact. And so all of these are interconnected. So I encourage us to take care of, do some self-care. During COVID years, we had leaders over there at our hospital incorporate mindfulness, things that have not been talked about in years. How do we take care of us? We take care of patients, and sometimes we run. We don't eat, we don't go to the bathroom, we don't drink water, and they realize the impact. So we got to take care of the temple and make sure all our dimensions are intact to be able to worship and serve. And so as we close off mental health awareness, let's take care of our mental health, do what we can in our power, keep ourselves fortified in the word, well prayed up, and in case some kind of form of mental illness come, be led by the Spirit to seek the necessary help and attention we need. If any loved ones are suffering, encourage them to seek help, but be sure that that person has to make the decision for themselves. Whether or not they decide to take medication, it's an individual matter, whether they want to start psychotherapy, whether there's things in our lives that we need to fix, like our diet or exercise or water or sleep, let's do those things. And so that if we end up on treatment, it will be able to work in our healthy bodies than having to work in our bodies not in the best of health and putting medication in a sick body, it's another story. So if we can be to our optimum health, just in case we have some mental issues, we'll be in a better place to accept and receive treatment. Thank you guys for listening. I have some references. By the way, there is a lot of information from the American Psychiatric Association, Centers for Disease Control and Prevention, Mayo Clinic. So you can search up and go to get more information on mental health, to be more knowledgeable and more informed, so that you can make an informed decision if needs be. Thank you. I will now